I'm Joanne Hammond, and I am one of the clinical academics through Western Department of Family Medicine, and I work at Victoria Family Medical Center, which is one of the urban sites. And what I really want to do today is tell you about the urban program of our residency, and just to let you know a little bit about how you can be more than just another resident in our urban program. So the urban program has 3 sites in London, Ontario, and that's Victoria Family Medicine, Byron Family Medical Center, and St. Joseph's Family Medical Center. And so we comprise the urban group. And that means that many of your rotations, at least your core family medicine rotations, will be in London at one of the centers. Now, Victoria Family Medical Center, where I'm most familiar with, is definitely a lower socioeconomic area. And we say that we take care of people who have 0 income to up to millionaires. And so although many of the people in our practice are a lower income group, we certainly do care for the needs of all people in that community and across London. The great thing about the Western Family Medicine program is that you have a faculty advisor program, and your faculty advisor is usually your preceptor. Preceptor means the person that you spend your first 4 months or 4 months of your family medicine residency with in first year and 4 months in second year, plus or minus 1 other month. And so really that faculty advisor gets to know you very well as a person. We see you clinically while you're taking care of patients at our centers, but also we'll meet with you every 3 or 4 months during your off-service rotations, just making sure that things are going well for you and the best that they can be for your teaching. I want to tell you a little bit too about the special interests of many of the members in our urban program. So we are a varied group of people. We all provide comprehensive family medicine to our patients and to our communities, but some of us have special interests. So my special interest is in obstetrics, and so I do a fair amount of intrapartum work with women, not only from our center, but I take referrals from other family doctors in the community. As well, I work at the Family Medicine Obstetrical group at Victoria Hospital, and I do that with both Laura Lyons and John Jordan and Stephen Wetmore and some of our other, and Larry Schmidt and a few other community family doctors. And we provide obstetrical care to some women who really don't have family physicians in the community and who need them. And some of their needs are quite great. So that's one of the special interest groups. We also have people who are very interested in palliative care. We have people who are interested in elder care, and we have faculty that are very interested in research. So it lets you know that not only will you be doing comprehensive family medicine in London, but you'll also, if you have special interests, we have people who have special interests. And I missed sports medicine as well. We have some of our faculty who are very interested in sports medicine. But what I really want to talk to you about is the greatness of family medicine, what you're getting in for. And I hope that our program is the one that can train you to be the great family doctor. But the privilege that I've had for the last 25 years taking care of patients from birth till death, and people talk about cradle to grave, and maybe it doesn't, it may not mean so much to you. Say, yeah, I hear that's family medicine everywhere. But to be able to kind of have a baby in your hands and 16 years later be able to be present when that baby's father is actually dying, and to be able to tell that baby, who's now a 16-year-old, what his dad said to him on the day that he was born, is one of the most moving things that I've had in my career as a family physician. And obviously, I still get welled up talking about it, but it was such a privilege to remember the child's birth and to remember that child's father's death, and to be able to have been an integral part in taking care of that family for that whole length of time. And I have so many stories, so it's not just my birth stories that I could talk to you about the greatness of family medicine. I have patients who really have had huge crises in their lives, and really it was family medicine and family physicians, their family physician, who helped them through some of the crises. And actually, patients have said to me, you've saved my life. And I think, how did I do that? But there was a sentence they heard one day that they were open that day to hear something, and that really did make a huge change in their life. So in our program, you're not just another resident. I hope you understand that. I hope you really want to come to London. I think London's great. I was born here. I went to school here. I did my residency here, and I guess I haven't left. But it's a wonderful place to raise your family. It's a wonderful place to grow up, and it's a wonderful place to learn about family medicine and then be able to practice.